Why are more and more people becoming obese in the USA? Obesity has emerged as a significant public health crisis in the United States, with obesity rates climbing steadily over recent decades. According to the Centers for Disease Control and Prevention, CDC, nearly 42% of American adults are now classified as obese. The reasons for this alarming trend are multifaceted, involving a combination of dietary habits, lifestyle changes, cultural influences, economic barriers, and medical factors. Don't forget to subscribe to the channel and turn on notifications so you don't miss out every time we release a new video every day. This article delves deeper into the primary causes and possible solutions to the obesity epidemic in the USA. 1. Unhealthy eating habits. One of the most prominent factors contributing to the rise in obesity is the prevalence of unhealthy eating habits among Americans. Fast food culture. The ubiquity of fast food chains such as McDonald's, Burger King, and KFC offers easy and convenient meal options. However, these meals are calorie-dense, high in saturated fats, and loaded with added sugars. With such widespread availability, fast food has become a dietary staple for many, leading to excessive calorie consumption without sufficient nutritional value. Sugary beverages, sugary drinks, including sodas, canned juices, and energy drinks, are a major contributor to weight gain. These beverages are calorie-rich, but do not provide satiety, leading to overconsumption. Studies have shown that people who consume sugary drinks regularly are at a higher risk of developing obesity. Supersized portions. The trend of oversized meal portions in restaurants and eateries further exacerbates the problem. Compared to global standards, American portion sizes are significantly larger, encouraging people to eat more than necessary in a single sitting. Processed and packaged foods. Highly processed foods, such as chips, frozen dinners, and baked goods, are laden with preservatives, unhealthy fats, and excessive salt. These products are affordable and convenient, but lack essential nutrients, making them a poor dietary choice. 2. Sedentary lifestyle. The modern American lifestyle has become increasingly sedentary, contributing significantly to the obesity epidemic. Desk jobs. The shift from physical labor to predominantly desk-based jobs has reduced the overall physical activity levels of the workforce. Many Americans spend long hours seated, either in offices or working from home. Screen time. With the proliferation of smartphones, tablets, and streaming services, people spend hours engaging with screens. Excessive screen time often leads to prolonged inactivity, disrupting the balance between calorie intake and expenditure. Car-centric culture. The heavy reliance on automobiles for transportation has replaced walking and cycling as common means of getting around. Suburban sprawl and a lack of pedestrian-friendly infrastructure further discourage physical activity. 3. Cultural and social influences. Cultural and social factors also play a crucial role in the obesity epidemic. Aggressive food marketing. Food companies invest billions annually in advertising unhealthy snacks, sugary beverages, and fast food. These advertisements often target children and young adults, creating a culture that normalizes the consumption of unhealthy foods. Time constraints. In the fast-paced American lifestyle, many individuals find it challenging to dedicate time to meal preparation. As a result, they resort to ready-to-eat meals or takeout, which are often high in calories and low in nutritional value. Social gatherings and celebrations. Many social events revolve around indulgent meals, desserts, and high-calorie beverages. This culture of celebrating with food contributes to excessive calorie consumption. 4. Economic factors and food accessibility. Economic disparities and unequal access to nutritious food are significant contributors to obesity. Affordability of unhealthy foods. Fast food and processed snacks are often more affordable than fresh fruits, vegetables, and lean proteins. This economic reality forces many low-income families to opt for cheaper calorie-dense foods. Food deserts. In urban and rural areas known as food deserts, residents lack access to supermarkets or grocery stores offering fresh, healthy options. Instead, they rely on convenience stores stocked with packaged and processed foods. Economic stress. Financial strain can lead to emotional eating or choosing inexpensive, unhealthy food options as a coping mechanism. 5. Lack of nutritional education. The absence of widespread nutritional education exacerbates poor dietary choices. Limited awareness. Many people do not understand how to interpret nutritional labels or evaluate the long-term health implications of their eating habits. Inadequate school programs. While some schools include health and nutrition in their curricula, these programs are often underfunded and fail to make a lasting impact on students. Conflicting information. The abundance of conflicting dietary advice from media and influencers can confuse individuals, making it challenging to adopt healthy habits. 6. Psychological and mental health factors. Psychological well-being is intricately linked to obesity. Emotional eating, stress, anxiety, and depression drive many individuals to seek comfort in food. Emotional eating often involves high-calorie, sugary, or fatty foods that contribute to weight gain. Sleep deprivation. Chronic lack of sleep disrupts hormones that regulate appetite, leading to increased hunger and cravings for unhealthy foods. Social isolation. Feelings of loneliness or lack of community support can exacerbate unhealthy eating patterns. 7. Genetic and medical factors. Biological factors also contribute to an individual's predisposition to obesity. Hereditary traits. Genetic predispositions can influence metabolism, fat storage, and appetite control. Families with a history of obesity often share both genetic and lifestyle risk factors. Medication side effects. Certain medications, including antidepressants, antipsychotics, and corticosteroids, can lead to weight gain as a side effect. Chronic illnesses, conditions such as hypothyroidism and polycystic ovary syndrome, PCOS, are associated with increased weight gain and difficulty losing weight. 8. Policy and environmental challenges. Policy gaps and environmental factors further complicate efforts to combat obesity. Weak regulation, limited government regulation on junk food marketing and sugary beverage sales allows unhealthy products to dominate the market. Lack of public spaces. Many communities lack parks, walking trails, and recreational facilities that encourage physical activity. Healthcare accessibility, preventative care, including nutrition counseling and fitness programs, is often inaccessible or unaffordable for many Americans. Additional factors. Amplifying the obesity problem. To fully understand the complexity of obesity, other contributing aspects must also be addressed. Eating culture. Social gatherings often revolve around high-calorie foods, such as barbecues, buffets, and parties, promoting overindulgence. Urban design. Many neighborhoods lack sidewalks, parks, or recreational spaces, limiting opportunities for outdoor activities. Healthcare costs. The high cost of preventative healthcare and nutrition counseling discourages individuals from seeking help. Work-life balance. Many Americans struggle with balancing work, family, and personal time, leading to unhealthy eating habits and limited time for physical activity. Potential solutions to address obesity. To tackle the obesity crisis, a comprehensive and collaborative approach is essential. Education and awareness. Schools, workplaces, and community organizations must implement robust programs to educate people about balanced diets and healthy lifestyles. Accessible healthy foods. Governments and nonprofits should work to eliminate food deserts by supporting local farmers markets and subsidizing fresh produce. Encouraging physical activity. Investing in public infrastructure, such as bike lanes and parks, can make exercise more accessible. Policy reforms. Imposing taxes on sugary drinks and unhealthy snacks while providing incentives for healthier alternatives can drive positive change. Supportive environments. Employers can offer wellness programs, and healthcare providers should prioritize mental health and stress management to address emotional eating. Technology for health. Encouraging the use of apps and wearable devices that track physical activity and calorie intake can help individuals make more informed decisions about their health. Obesity is a complex societal issue that demands collective action. By addressing the root causes, from unhealthy dietary habits to systemic economic barriers, and implementing sustainable solutions, the United States can work toward reversing the obesity trend. A healthier future requires collaboration across individuals, communities, policymakers, and industries to create lasting change. Comprehensive measures coupled with persistent efforts will pave the way for a society that prioritizes health and well-being for all.